So your child was just diagnosed with autism, and the doctor recommended that you go to ABA therapy. He said, this is what you need, it'll be great. So you get online or go to your friends and you say, okay, let me try to figure out who's the best person that I can get to do ABA therapy for my child. And then instead of recommendations, what you come up with is a list of reasons why you should not do ABA therapy. You should never do that to your child. It's awful. And you're like, what do I do? My doctor said, do it. My friends or other people in the community are saying, don't do it. How do I know what to do? The title of this video is To ABA or Not to ABA? That is the question that we're going to try to answer. I'm Dr. Eric Newman. I'm a licensed clinical psychologist. I specialize in psychological testing, and a lot of my testing cases are trying to diagnose kids or rule out autism spectrum disorder. So I get this question a lot. Is ABA therapy a good thing? Is it going to be helpful? Is it a bad thing? And we're going to dig more into that topic. So before we do that, we got to answer the question, what is ABA therapy? So ABA stands for Applied Behavior Analysis, and it is an intensive approach that is considered like the gold standard treatment for autism. It is not the only treatment for autism, and it is also not necessary for every child with autism. But it is considered the gold standard. Like I said, it's more intensive. It usually is for at least a few hours a week. It could be more. Essentially, ABA is like a highly efficient learning system. It is behavioral programs are developed by ABA therapists to either promote development of certain skills, like originally language skills, but many other skills as well, adaptive skills, could be communication, executive functioning skills, social interaction. And it also is useful at extinguishing or reducing maladaptive behaviors. So things you don't want to see, like a lot of kids with autism will hit or kick or spit or bite. And you want to obviously get rid of those behaviors. And ABA therapy focuses on what they call the ABC chain of behavior. So that means antecedent, behavior, consequence. So for any given behavior, that's the B, you're going to look at the antecedents and the consequences. So the behavior could be a behavior you want to see more of, or it could be a behavior you want to see less of. So taking, for example, a behavior you want to see less of, like kicking, what you would do is then look at what are the antecedents. So what are the conditions under which your child kicks? And you want to try to do whatever you can to manage those antecedents to make it less likely for those things to happen again. And then on the consequence side, how are people responding? This doesn't mean punishment, but it means how are people responding to the behavior when it occurs that either makes it more likely to occur again, or how can we manage it so that it's less likely to occur again? So that's kind of the gist of the ABC chain, and that's sort of the center of ABA therapy, because essentially they're going to come in and determine what behaviors are most problematic, what need to be the targets for treatment, or in some cases, what skills do we need to develop? And then we're going to look at those different sides of it and develop a program to figure out what is the best way and the most efficient way to teach your child to behave differently. Now, ABA historically has had many different approaches, and it's really developed over time. So that brings us to what the objections are to ABA therapy. So the first one is that a lot of people will tell you, don't do ABA therapy because it's either aversive or it's coercive in some way. And that's really based in the history of ABA. So many decades ago at this point, when ABA therapy was first developed, it did involve kind of tactics that were considered aversive or coercive. So, it could provide sort of unpleasant consequences for behaviors that you don't want to see. And sometimes it could just seem dehumanizing. It could be kind of like a dog, teaching a dog tricks or something like that, where it's just like, do this and you get a treat, do this and you get a treat, or something like that, where it just treats a child more like a dog than a human. And, also people do have concerns about just how intensive it was. A lot of times it was like, 40 hours a week of this intensive intervention. But that's not the way ABA therapy is done nowadays. So nowadays, it's very different. We have, much more flexible interventions, things that are delivered in fewer hours, but also in more naturalistic settings. And it really takes advantage of those natural opportunities to teach those lessons in ways that, they didn't before. I'm certainly not an expert in ABA, so I'm not going to tell you, what are the exact ways that happens. Now, I say I'm not an expert in ABA, and you might be wondering why you should even listen to me on this topic. I should tell you, I am a clinical psychologist, but also I did a lot of training in settings where they kind of cross-trained in ABA and psychology. So I do have more experience in this area than the typical person or the typical psychologist probably. But also, if you ask the question of whether you should do ABA therapy to an ABA therapist, you might think you'd get a biased answer because that's what they do, right? Whereas I don't do ABA therapy. I don't have any skin in that game. I just know what I see to be effective. So that being said, let's go on to the second objection that you often see with ABA. But before we do, if you're getting value from this video, I would really appreciate it if you'd hit the like button and subscribe to this channel. That way more people will know who are looking for this kind of information that they should check us out. All right, so the next objection to ABA therapy is that people will say, it's not so much that it's aversive or coercive, but it's just not very affirming of neurodiversity. So, there's a big push nowadays to have a sort of a neurodivergent mindset rather than looking at autism as a disorder. We should look at it as sort of a natural variant. It's something that, is sort of maybe different from the norm, but plenty of people have it. And why should we treat those people any different? Why should we teach them that they can't be themselves, that they need to be somebody else rather than who they are? And that's very true. That's an excellent point. However, what comes along with that is the expectation that society needs to be the one that adapts, not the individual. We all need to be more accepting. And while I fully agree with that, you can't get away from the fact that society is still society, and it's still going to do what it does until we get to the point where we are much more affirming of that. And so that's the problem with that argument. So what is my overall recommendation for to ABA or not to ABA? I think it's important that we, like I said, ABA is not the only approach, and it's also not it's not necessary for everybody. But if your doctor tells you that ABA is what's recommended, you should probably listen to your doctor about that and not someone who's giving you other information. And, really what it comes down to is we need to be teaching these kids the skills to adapt. And that doesn't mean they always have to adapt. They don't have to be someone they're not in order to fit in. But if they have the skills, then we can allow them to decide when they want to use those skills. They can decide this is a situation where I want to fit in or I need to fit in order to be part of a social network or get a job or, any number of things. And maybe this other situation is not one that I want to do that in. Maybe I want to be myself in this situation. And if they're not okay with that, that's fine. They don't need to accept me. But the bottom line is you want your child to have the skills necessary and then decide for themselves what they want to do. You don't want to put them in a position where they're not equipped for the world that they're in, and now they don't have a choice. So I hope that was helpful, and I look forward to seeing you in future videos. Take care.